A bit of health now. 97% of Nigeria's population is not covered by any kind of health insurance, now leaving just 3% with insurance. That's according to the Nigerian Demographic Health Survey report of 2018. This is why a review meeting by the National Health Insurance Authority is underway in Abuja. A two-day meeting is expected to drive the ongoing reforms of the NHIS through building capacities and competencies of middle to senior level managers of the agency. Health correspondent Kemi Balogun has details.
Less than 10% of Nigerians are covered under the National Health Insurance Authority scheme, even after 2 decades. Experts remain worried that this could be catastrophic, with a growing population of more than 200 million citizens and majority not having access to proper healthcare services. For years, it has been the goal of the National Health Insurance Authority to ensure that it drives health financing and policy reforms, and now it is doing so through its leadership training program. The agency also reveals that the training program will translate into an Institute of Universal Health in the near future.
In future, this leadership program will transmute into Institute of Universal Health, IUH, and in much future, it will transmute into University of Universal Health.
It is obvious to me that with the coming to being of this new act, there will be modifications in what we had earlier planned to suit the new reality.
This review meeting is expected to change the tide and improve service by equipping and building the capacities of middle to senior level managers of the agency with the knowledge that they need. This will be achieved through the help of a collaborative effort with several institutions to drive the NHIA training program.
One of the things that we see as critical in this very initiative is its ability for them to be able to practice and implement, to create the changes that we need in the system.
What we have done in the last 20 years, will be 20 years next year, is that we'll be reconstructing the boxes. And the boxes that we've been reconstructing, we've been seeing their footprints of change. We see that not only in the private sector, because people always say, oh, it's so difficult to transform in the public sector, but we're seeing that in the public sector.
We also have the Medical Credit Fund, which is a fund of over $40 million meant to catalyze investment in the healthcare sector. Because what we were finding is that we're demanding quality and we are pushing people to enroll, but the quality of the services being provided is not good enough.
Some of the proposed modules assigned in the MOU will be hinged on healthcare financing, public financial management, and leadership enhancement. Kemi Balogun, TVC News, Abuja.